When should women start following cervical cancer screening guidelines? Have you ever wondered when women should start following cervical cancer screening guidelines? This is an important topic for women's health. Generally, women should begin cervical cancer screening at age 25 or 30. The exact age can depend on the specific guidelines being followed. Screening should continue until age 65, with regular intervals based on the type of screening used. Current evidence and international consensus highlight the use of high-performance human papillomavirus testing as the primary screening method. This approach has largely replaced or supplemented traditional pap smears because it offers superior sensitivity and long-term protective benefits. Most countries recommend starting screening at age 30. For those who begin at this age, HPV testing is typically done every 5 years. Some guidelines suggest co-testing, which combines a pap smear and HPV test. The World Health Organization encourages that at least 70% of women aged 30 to 49 be screened at least twice in their lifetimes using HPV testing. This age range is crucial for effective detection and prevention of cervical cancer. For women aged 30 to 65, primary HPV testing every 5 years is advised. This method is more effective in identifying high-risk HPV infections that can lead to cervical cancer. It also reduces unnecessary follow-ups and enhances early detection of precancerous changes. Screening may be adjusted based on individual risk factors, such as immunosuppression or previous abnormal results. However, routine screening generally ends at age 65 if prior results have been consistently normal. An emerging strategy is self-sampling for HPV testing. This method aims to increase participation in screening, especially for women who have difficulty visiting clinics. Studies indicate that self-collected samples can be just as effective as those collected by healthcare providers in detecting high-grade precancers and cancers. HPV vaccination is another important aspect. Ideally, it should be given before age 15 to prevent most HPV infections that can lead to cervical cancer. However, even if a woman has been vaccinated, she still needs to continue with regular screening later in life. Cervical cancer screening plays a vital role in women's reproductive health care. Early detection through appropriate screening intervals can significantly reduce the incidence and mortality of cervical cancer. Unlike testicular cancer, which typically affects younger men, cervical cancer screening focuses on women in mid-adulthood when precancerous lesions are more likely to develop. In summary, women should start following cervical cancer screening guidelines by initiating HPV-based screening around age 25 to 30. They should continue this practice regularly through age 65, typically every 5 years. This strategy aligns with global efforts to eliminate cervical cancer through vaccination, effective screening, and timely treatment. Always consult healthcare professionals for personalized screening decisions based on individual health status and risk factors.